Hello student, today we are going to learn about peptic ulcer disease. So it is a disorder of GI tract. It is a topic of medical surgical nursing which is a subject of BSc nursing second year. So let's move toward our topic. So in this lecture we are going to discuss about the introduction and type of the peptic ulcer, their etiology and causes, sign and symptoms, diagnostic evaluation, management, which include our nursing management, medical management, and surgical management, and last, nursing diagnosis and their interventions. So peptic ulcer is nothing but it is a breakdown of continuity of mucosa membrane of the stomach or affected area. So definition said it is defined as breakdown in continuity of mucous membrane of duodenum, esophagus and stomach. If it is happen in duodenum, it is called duodenal ulcer. If it is happen in esophagus, then it is called esophageal ulcer, and it is happen in stomach, then it is called gastric ulcers. So it is nothing but a sore that form in mucosal wall of the stomach, duodenum or in esophagus. So let's discuss about the type of peptic ulcer. So there is a three type of peptic ulcer. First one is duodenal ulcer, second is esophageal ulcer, and third is gastric ulcer. Depending upon their location, this type can be categorized. We discuss about each and every ulcer one by one. So first is our gastric ulcer. So it is breakdown of membrane of stomach. The reason behind this is due to some substance like alcohol, caffeine, aspirin or non-steroid anti-inflammatory drugs like diclofenac, paracetamol. So these are the causes behind the gastric ulcers. This will irritate the mucosa of the gastric region, and that will lead to the ulcers. So let's learn about the pathophysiology behind this. So first is due to drug. We already discussed about like paracetamol, diclofenac, which is a non-steroid anti-inflammatory drugs, or due to alcohol, coffee or tea or caffeine. This will lead to the excessive secretion of a HCl inside the stomach and decrease the synthesis of mucous membrane inside the stomach. And this will lead to the breakdown of mucous membrane of stomach, and then acid enter in that region where the breakdown occur, and it will lead to gastric ulcer. So let's revise our pathophysiology. So due to drugs like non-steroid anti-inflammatory drugs, caffeine, alcohol, coffee, it will lead to the excessive secretion of HCl and decrease mucus secretion inside the gastric region, and this will lead to the breakdown of mucous membrane of stomach, and the acid enter at that breakdown region, and it will lead to the gastric ulcers. Second is duodenal ulcer which is occur in duodenal region called duodenal ulcers. So the main cause for having this ulcer is overstimulation of vagus nerve which control the gastric movement of stomach during the resting or fasting period. मीन्स अगर कोई पेशेंट या पर्सन फास्टिंग पीरियड पे है, लाइक नवरात्रि और रमज़ान के टाइम पे जैसे लोग रखते हैं, कंटिन्यूस फास्टिंग रखते हैं, तो उस टाइम पे हमारे स्टमक की वेगस नर्व ओवर स्टिमुलेट होती है, जिसकी वजह से गैस्ट्रिक इमोबिलिटी क्रिएट करती है और गैस्ट्रिक अल्सर क्रिएट करती है. सो लेट्स मूव टुवर्ड द पैथोफिजियोलॉजी ऑफ ड्यूडेनल अल्सर. सो फर्स्ट स्टेप इज ड्यू टू फास्टिंग stimulation of a vagus nerve occur, and this vagus nerve stimulation cause increased gastric secretion. Increased gastric secretion lead to the HCl secretion level increase, and that will lead to the duodenal ulcer. Means fasting की वजह से vagus nerve stimulate होगी, gastric secretion increase होगा, जिसकी वजह से HCl increase होगा, और increase HCl क्या करेगा, break down करेगा mucosa membrane of duodenum. So let's talk about the difference between gastric and duodenal ulcer one by one. So first step or the first point in gastric ulcer or duodenal ulcer is gastric ulcer occur in stomach, whereas duodenal ulcer occur in duodenal region. Okay. Second step is the cause of gastric ulcer is NSAID, alcohol, caffeine, aspirin. Cause of duodenal ulcer is overstimulation of vagus nerve during fasting period. Third point is the pain which is occur in gastric ulcer is epigastric region, or in duodenal ulcer the pain occur in right epigastric region. Fourth is nausea is very common in gastric ulcers, but in duodenal ulcer it is rarely found. Fifth point is vomiting with blood occur in this case, but in duodenal ulcer the stool with blood occur inside the patient. Seventh is pain start just after taking the food, or in duodenal ulcer what happened, the pain is occur after taking the food after 2 and 3 hours. Eighth point of gastric ulcer is pain is present while hungry, whereas in duodenal ulcer it is not present. Ninth point is pain is regular, whereas in duodenal ulcer it is not regular or irregular. In gastric ulcers, malignancy is not common, means this gastric ulcer will not lead to the cancer in future. But duodenal ulcer are very common to convert into cancer or benign tumor. Let's talk about the esophageal ulcer. It is a type of peptic ulcer. So here what happened, ulceration occur in esophageal region. The cause of this is due to HCl reflux inside the esophageal region. Mostly where this can be seen in the lower esophageal region. Means क्या होता है, जो एसिड बनता है स्टमक में वो रिफ्लक्स होता है ईसोफेगस की तरफ, जिसकी वजह से वो ईसोफेगस की म्यूकोसा वॉल को डैमेज कर देता है, और ये कॉमनली सीन होगा लोअर पार्ट ऑफ ईसोफेगस जो कि स्टमक से कनेक्ट है. नेक्स्ट इज स्ट्रेस अल्सर्स. It is not a type of a peptic ulcer, but it is seen in patient. So we call this ulcer is stress ulcers. So what happened here in chronic conditions, like in chronic condition what happened, the parasympathetic nervous activate or stimulate. This will lead to the vasoconstriction of a stomach area, and that will lead to stress ulcers. Means when the blood supply inside the stomach will reduce, this will lead to the ulcer inside the stomach or breakdown of a mucous membrane of the stomach. Thanks for watching. If you like this video, make sure to subscribe for more.